There are so many myths about Lyme disease, I honestly don't know where to start. Some people and doctors think that Lyme disease can be treated with one prescription, meaning like one dose of antibiotics, and that could go from one pill, like one pill does anything. You take one pill of like an allergy over the counter something, or one pill of Advil, and you really think that's gonna help your headache? Like, you at least gotta take the full dose, 2 Advil, like if you're an adult. And then there's doctors that think 2 pills, and then that cures all. A cure? I don't even know if there's a cure to Lyme disease. I'll talk about that later. And then there's the people who think a week. The doctors. Okay, these are all wrong. There's no one pill. If there was one pill that cured Lyme disease or put it into remission, whatever way you want, I would have taken that years ago. I would have taken that when I was diagnosed at 17. There is not one. And they're most likely, in most cases, talking about doxycycline, or if the child is too young to take doxy, because I forget the age that you're supposed to be to take that. There is another medication, which I cannot remember off the top of my head, that they give to younger kids. So, some doctors say 2 weeks, some doctors do a month. Still, not enough time to treat chronic Lyme disease. Not enough time to treat acute Lyme disease. It just doesn't make sense. The life cycle of a tick and the life cycle of Borrelia burgdorferi, the bacteria that comes from a tick that creates Lyme disease. It just, more time. 6 weeks minimum. I would say like 2 months on antibiotics for an acute bite. So that has so many myths about it. Just acute Lyme disease, and of course chronic Lyme disease not being real. I don't know what other information the CDC or the IDSA wants, because I guess we're either all faking our symptoms or they're all caused by other things. But yet when I take a test, it comes back positive, so I'm not really sure why a positive test for someone with lupus is acceptable, but another test that picks up better and you have to pay $1,500 for, is it enough for someone to believe that you have Lyme disease? Not really sure about that one. Lyme disease can be sexually transmitted and can be transferred from mother to child during birth congenitally. It doesn't mean it will happen, but it's possible. And again, there are people that this has really happened to. So it just makes no sense to say that this isn't real, and that the two sides of people not believing in chronic Lyme disease, I don't know where their heads are, but I think they have something missing between their 2 ears. That's all I can say. Lyme disease is not screened well in the blood supply. So if I were in a life, death situation and needed a blood transfusion, of course I would take it. I mean, not everyone is that way, because there are different views on blood transfusions and religious beliefs and such, but I would take it. But they highly screen for Babesia and talk about the problems of Babesia, which is another tick-borne disease, which I'm very familiar with. But yet, they do supposedly screen for Lyme, but not well. So, that's a problem. Another myth of Lyme disease is you have to have the bullseye rash. You need to have a rash. I think I had one friend that had the rash. A rash. and that the tick has to be embedded for like 48 hours. And like some websites say like 72 hours. Like, I don't even know. There's so many different things. Some say like 2 days. Some say like 3 days. Some say like 24 hours. Some might say like 18 hours. Like, I don't even know these days because there are so many different sources. There's so many different answers. Like, yes, there's so many sources, but all the sources should be saying the same thing so you know what you're getting is correct. But how can you trust any information when you're getting 18 different answers, when not all 18 can be right? There's only one answer. So a tick does not need to be attached for 24 hours or 48 hours or 72 hours to transfer Lyme disease or any co-infections to your body. Now, the bacteria comes from the tick's stomach, and it does need time to like regurgitate. Think of like the tick literally throwing up their saliva to get into you. The tick can already have been regurgitating and getting the saliva, the infection that they have, which is Borrelia burgdorferi, Babesia, a bunch of other tick-borne infections, up into their mouths. So when they bite, it's already being transferring. So this is a big thing in Under Our Skin, which is a movie. I highly recommend everyone to watch that. You can watch it on, iTunes, and you can rent it on iTunes for a couple dollars. Highly recommend it. There is no safety window for having a tick bite and getting different diseases. It's just doesn't work that way. Look at all these beautiful leaves down here. I wouldn't be letting your kids and your dogs run and play through those. Yes, there are going to be leaves on the ground if you live around areas I live in. But eggs from ticks they hide. I'm having such a hard time speaking today because of my brain fog from Lyme disease. The ticks from eggs like to be in leaves, and ticks like to hide in leaves. And your dogs and yourself should always be protected when you go outside. It's fall where I live. It is a prime time for ticks. It is not just a spring thing. It's not just a fall thing. It's not just a summer thing. This is a year-round thing. And it's also not just a northeastern United States thing. That's a huge myth that it's only like Connecticut and Massachusetts and the Northeast. No, Lyme disease is a huge problem in Florida. Lyme disease is a huge problem in Ohio, in Pennsylvania, in North Carolina, in South Carolina, in California. All 50 states. Lyme disease is a huge problem in Canada, where you could barely find any Lyme literate doctors because there was a point where Canadian Lyme doctors were all shut down. I don't know where that is right now, but that's very hard, and lots of them have to come to the United States. And the more south you go, the more they're like, there aren't ticks down here, there isn't this down here. But there are. Like I said, like in Florida, in the south, there are ticks. There are diseases transferred by ticks, more than just Lyme disease. And it's a very big threat. Australia, huge problem. People having to come to the US. Germany, problem. Those are big countries that I can think of off the top of my head. But it's a problem everywhere. And it's such a big problem that many countries don't even know it's a big problem. That's a big problem. Lyme disease is a life-altering illness. God, I ate my ketamine so bad. My pain is so bad. It makes you get all of these different disorders. It gives you autoimmune problems that mess with your brain. It gives you trouble walking. It gives you cognitive impairment, which caused me to be unable to go to college. It gives you all kinds of thyroid problems and sleep, insomnia problems. Lyme disease can give you a higher risk of cancer. It is a neurodegenerative disease. It destroys your gut. It destroys your nerves. It's destroyed my eyesight. I need to go back to my eye doctor because I can't. This prescription needs to be upped again to who knows what. It messes with your brain so bad that it, causes seizures and mood changes and personality disorders like bipolar disorder or eating disorders or schizophrenia and depression and anxiety, hallucinations, and all these weird things that, again, people don't think of to screen for Lyme. And the test is so bad, the ELISA test, that at this point it's I don't care what someone says they get on their ELISA test, if it's positive or negative. Well, if it's positive, then you're lucky, but if it's negative, because it's mostly negative, that it really doesn't matter. So yeah, don't trust an ELISA test. It's ridiculous how Lyme disease is the infectious equivalence of cancer, according to Dr. Neil Spector, who is an oncologist at Duke, I believe, and he wrote a book. So just Google Neil Spector Lyme disease. I forget what his book is called, but he had to get a heart transplant from Lyme disease. And nobody believed him, and no one believed his symptoms, and he thought it was all in his head, and he was stressed because he was a doctor, and he's got a big job, and so he's a huge Lyme advocate, and very Lyme literate. People see other people and hear of other people going through cancer and how chemo makes them feel worse because of all the side effects, and most commonly known of losing their hair. But yet when a Lyme disease patient has a herx and gets worse because of the bacteria dying and neurotoxins and toxins being spread, people think you're crazy that you're taking a medication that makes you worse, even though it's just like taking chemotherapy. It's trying to help the person, but it gives really nasty side effects where, all medications have side effects, and this causes really bad bacterial die-off reactions. And that's very, very misunderstood, or just not understood at all, that even happens, that Lyme patients have to suffer through treatment. You don't just feel better like you're taking, like you have a cold and you get better and after 3 days your cold is gone. No, you're constantly fighting, and the harsher treatments you try to get yourself better, the more sick you can feel, and that can lead to hospitalizations and ER visits and nights crying on the bathroom floor, as I've experienced many too many. I mean, these are some of the myths and the truths of Lyme disease. It causes me to be unable to come outside and play with my beautiful dog Sonoma every day, because while I'm sitting here right now filming this video, my head hurts so bad because of the air touching it and because of my hair touching my scalp. But I can't cut my hair any shorter than it is now without shaving it bald. And that's why I cut my hair. Pretty sure that's mentioned. I can't wear anything softer. I'm constantly have to be drinking hot beverages to try to keep my inner like my core of my body hot, because I'll be cold even in the summer, and I'll be wearing sweatshirts even in the summer, and heated blankets. So I'm really dreading the winter with my sensitivity to touch, my allodynia, and really bad pain and neuropathy. But I'm also really looking forward to trying to get more help from ketamine, which of course is not covered by insurance because it's an off-label use, which is ridiculous because there are things talking about ketamine working for chronic pain going back like centuries ago. But, you know, any way for this country to make money, it's making lots of money off these Lyme disease patients paying out of pocket for everything. That's not fair, is it, Sonoma?